What is acute stress disorder? And how do you get it? Acute stress disorder is caused by actual or threatened death, serious injury, or sexual violation in one of the following ways: directly experiencing the trauma, witnessing the trauma happen to someone else, learning that the trauma happened to a close family member, or repeated and extreme exposure to the adverse details of a trauma. And what we're talking about here are things like picking up body parts on the battlefield, or police officers being exposed to the traumatic details of child abuse. Although it may seem like it and feel like it, when we're talking about acute stress disorder, this does not apply to being exposed to the adverse details via social media, TV, the internet, any of those type of things, unless it's part of your job. So now that we know how acute stress disorder starts, let's go over the symptoms. In order to meet criteria for acute stress disorder, you must have 9 or more of the following symptoms in any of the following categories: intrusions, negative mood, dissociation, avoidance, and arousal. When you're hearing all of these symptoms, you might think, hey, that sounds very familiar. It sounds like PTSD. You're right, it does. And if you wait to the end of this video, I'm going to show you actually why it sounds so similar. All these symptoms need to either start after the trauma or get worse after the trauma. The first category is intrusion symptoms. Intrusion symptoms may be intrusive, involuntary, repeated thoughts or memories of the traumatic event, especially when you don't want them to. Another symptom might be recurring dreams that are related to the trauma. For some veterans, this might mean just a replaying of what happened. For others, it might just be a recurring theme. It might not have happened how it happens in your nightmare, but the theme is the same. You're trying to escape, or somebody's out to get you, or you're having mortars come to you. Maybe the mortars in your dream are meteors. Our brain is weird like that, likes to change stuff up. Intrusive symptoms also may look like dissociative reactions, such as flashbacks, a time in which you actually believe that you were back during the time of the trauma. Another intrusive symptom might be intense psychological distress, when you're triggered by something that reminds you of your trauma. The next category is negative mood, and the symptoms are pretty straightforward. The inability or reduced ability to actually have those happy feelings, to have positive feelings. There's a word for this. It's often called anhedonia. If you want to learn more about anhedonia, I made a whole video about it, and I'll link that down in the description. A dissociative symptom may be you start to lose touch with reality about yourself or about your surroundings. This might feel like being in a daze, or like time is moving more slowly, or like you're viewing yourself from someone else's perspective. Another dissociative symptom is actually forgetting important aspects of the trauma. This is usually from some type of dissociative amnesia, or blocking it out somehow. Now, this doesn't apply if you were drinking at the time, intoxicated off drugs at the time, or if you had TBI. If you watched any of my videos, you know I'm going to talk about this next category, which is avoidance. And when I talk about avoidance, I'm talking about avoiding memories or thoughts or even emotions related to the trauma. But that's not it. You can also avoid certain people, places, situations that remind you of your trauma. Other symptoms may be irritable behavior or have an angry outburst. I know some of my vets got that. Problems with concentration, exaggerated startle response, or hypervigilance. And hypervigilance is a tricky one with veterans because we're taught attention to detail. So there is a difference between hypervigilance and attention to detail. And here's what I like to give people an example of. If all you can do is track your surroundings, well, guess what? You're probably actually not that good of an operator. And I say that because tracking your surroundings is generally not the actual mission. That's just part of many of the things that you're doing at that time. With hypervigilance, often all you can do is track. All you can do is be on guard. And it takes away or maybe even eliminates what you're actually trying to do. In order to meet criteria for acute stress disorder, you must have these 9 or more symptoms in any of these categories for at least 3 days, but no longer than 30 days. That's a pretty short window, 27 days. You might say, hey doc, this sounds a whole lot like PTSD. And you're right, it does. It's actually a lot of the same exact symptoms of PTSD. But here's something that's different. Not everybody who presents with acute stress disorder develops PTSD. Now, it is a high percentage though. It's about half. About half of the people that develop PTSD presented with acute stress disorder first. Now, my theory on this is that actually that number is a little bit higher. But here's the thing. A lot of the time when people are 30 days post-trauma, they haven't came to see me yet. It might even be 30 years in some cases before somebody comes to see somebody like myself. So a lot of those cases with acute stress disorder are not being caught early. And one of those reasons is because of one of the symptoms, avoidance. Who wants to re-experience potentially their trauma when their trauma just happens? Makes perfect sense. What I will say is treatment can help for not just acute stress disorder, but also PTSD. So if you are struggling with some of these symptoms post-trauma, my suggestion for you is to seek help and seek it early. Because if we can see you early, that means we can treat you early. And that means you can go on with your life to do those things that you want to do. Whether that's be with your kids, whether that's be a better husband or wife, or maybe you want to get back out there and go deploy again. Yet another reason to treat PTSD or acute stress disorder. Something to think about. If this video was helpful for you, and I hope that it was, please like it, Subscribe to my channel if you want to learn more about PTSD or mental health. But more important than that, if this video was helpful for you or reminds you of a fellow veteran, I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.